he started off with this, that there is a paper in Lancet which says that ketamine treats depression, and it is a very excellent research paper. So why don't you do something about it? And we started looking for it, but unfortunately, because of the various factors, like in psychiatry, we don't have anesthesia people coming in. And most of the time, a specific training is required to introduce ketamine to people. So we were not very confident about it. So we were not able to do anything about it. That was back in 2013. But the later on, people start building it up. From that research paper, it kept on building up. And now psychiatric research is increasingly revealing the therapeutic potential of these one fringe countercultural compounds. So ketamine is used across the globe, but perhaps no drug had a better year than a ketamine, a mainstay of anesthesiology and rave scene of the 1990s and early 2000s. So this was, I am talking about early 2000 when that research paper was published. There were only a small number of people who were given ketamine and their depressive symptoms improved. I think it was hardly 13 people in that research. So very small number, but then it kept on building up. And then a review was published in Neuropharmacology in November 2022. So this is the basic, a review article which was reviewing all the data published across the globe related to ketamine treatment. And they found that ketamine shows promising results for reducing suicidality at up to 24 hours after administration compared with its effect on psychosocial functionality, cognition, and anhedonia. So, not all the symptoms of depressive disorders were addressed, and they found out that if we introduce ketamine to a depressed people, the psychosocial functionality, cognition, anhedonia, mood symptoms, they take some time to get better. But this is a review article I'm quoting, Neuropharmacology 2022. But the researchers noted that ketamine's rapid action is one of its chief advantages for efficacy in instances of suicidality. So people who come to you and they express a suicidal ideation, an intense suicidal ideation, which is clinically significant for you to intervene. Most of the time, these patients are admitted, hospitalized, and then treated effectively, of course. So it is said that if these patients are given ketamine, their suicidal thoughts they disappear within days. However, the other depressive symptoms may take some little time, but of course, much quicker than the antidepressants, because antidepressants take about 3 weeks to 6 weeks time period to have an effect. So this article published in Neuropharmacology Journal, I have the reference as well. It says that suicidality can be prevented very easily by ketamine administration in people with MDD or other situations. So if person expresses suicidality and it is intense, a ketamine administration in 24 hours rebounds back that those thought processes and patients are actually not that unwell. So this is one breakthrough. The second breakthrough was pharmacogenetic testing. Again, back in early 2000s and late 2000s, uh, the 2010, late 2010, this test was in the market and it was very expensive at that time. And very few drugs were actually seen to be assessed in these type of tests. But later on, it was a breakthrough. So imagine taking a guesswork out of selection and appropriate antidepressant. So usually it's our clinical judgment which antidepressant to be prescribed to which patient. Sometimes that toss of the coin, our clinical judgment hits and sometimes it fails. But if we know that for sure that this drug will definitely help this gentleman, just like the culture sensitivity in cases of infection, it is a breakthrough. So pharmacogenetic tests are paving the way towards selecting the optimal drug for each patient. It also referred as pharmacogenomics, is an area of research that is shedding light on how genes predispose reactions and responses to specific drugs. Currently, these tests are available for only a handful of drugs. Still, back in 2000s, there were only three antidepressants which were involved. Now, the psychiatrists are pleased to know that several of these tests apply to pharmaceutical mainstay of their armamentarium, such as antidepressants, antipsychotics, and ADHD treatment strategies. So you know which drug to be prescribed, and it will definitely click. The evidence is demonstrating the efficacy of pharmacogenetic testing. For example, a meta-analysis published in Pharmacogenetics Journal in October 2022 found that in patients with major depressive disorder, genotype-supported treatments led to better response and remission rates after 8 to 12 weeks of treatment. So this paper, which was published in Pharmacogenetics Journal in October 2022, it's a meta-analysis, and it says that 8 to 12 weeks time period, get the test done, start that specific drug, and in 8 weeks to 12 weeks time, the patient will be okay. So this is a major breakthrough, second major breakthrough. Then with COVID, things were more complex. And surprisingly, there was a paper published which indicated best results for fluoxamine. So it's nice when you don't have to reinvent the wheel. That was the case this year with the SSRI fluoxamine, which is commonly used to treat OCD. It turns out that fluoxamine may have another use, preventing COVID-19 hospitalization. It was again something just came up, and then there were trials that people who were given fluoxamine needed the less chances of being hospitalized during the COVID-19 infection. A meta-analysis published in JAMA Network Open in April 2022 evaluated qualifying randomized clinical trial evidence for fluoxamine in outpatient COVID-19 management. To be included for consideration, studies have to be placebo-controlled. In total, the researchers evaluated 3 trials with a total of 2,196 participants. They found that fluoxamine probability of any association with reduced hospitalization ranged from 94 to 98%. The probability of moderate association range from 81 to 91%. Now, this is a very high figure. So if somebody is given fluoxamine, if somebody is having COVID-19, suspicion of COVID-19, and he's given fluoxamine, the chances of hospitalization reduces to 90%, which is a very, very significant number. So this was again published in JAMA in April 2022. So this is again very specific third breakthrough in psychiatry. And there are all again meta-analysis, reviews, or again Cochrane reviews. So you have to understand that. The third breakthrough, again, like ketamine, is used for other disorders as well, but the outcome was only for one thing: reducing the suicidality. Pharmacogenomics was applied for multiple areas, but best possible results are achieved for antidepressants. And these are because I am talking about the, again, review articles only or meta-analysis only. Deep brain stimulation. For decades, psychiatric interventions for major depressive disorders have been somewhat confined to psychotherapy, pharmacotherapy, and electroconvulsive therapy. But now the research indicates that an alternative option may be emerging. Deep brain stimulation involves the surgical implantation of electrodes in specific areas of the brain Targeted electrical impulses in these areas can affect brain activity and address chemical imbalances. Now, this is again a study published in Dialogues in Clinical Neurosciences in April 2022 highlighted how this will be an area of research to watch in the years ahead. So far, it's been proven to be preliminary effective in patients with the treatment-resistant depression. And neuroimaging studies are helpful researchers understand where to stimulate for desired outcomes. Now, this is again, deep brain stimulation is only effective for people who are having resistant depression. Don't quote me wrongly. So I am specifically highlighting the words. Deep brain stimulation is for treatment resistant depression. Again, ketamine is indicated for suicidality. Evidence is more in favor of that. Otherwise, again, these strategies are used for so many other indications, but still we lack specific data related to it. Then the next one, rise of telepsychiatry. When I started doing clinics in 2015, online clinics, 2015, 2016, people were very reluctant to come and see me because they were thinking that, well, this gentleman is sitting on the net and he's talking on a screen. How can he treat us? At that time, it was something vague, and telepsychiatry was used earlier as well. So there were some clinics where the telepsychiatry was used. However, it was not as effective as it should be or as effective as it is now. So now we have the data. Decades from now, telepsychiatry may be something psychiatric students look back on and wonder, why didn't I think of that sooner? Few technological breakthroughs have so radically altered the practice of psychiatry, and patients appear to like the change. This is the key. The patients like it. So I'm sitting here, my patient is sitting thousands of kilometers from me. He is seeing me and I'm providing the services. The only problem is that when the patients are sitting at their homes, the setup is not very nice. Like Wi-Fi system in Pakistan is terrible. People are sitting in their lawns, they are eating food, they are lying down in beds, they are in a casual mood. So of course, those hindrances are still there. The psychiatric consultation requires specific areas where patient is sitting in front of you face to face in a way that you are able to assess something, few things like facial expressions, body movements, like, and you are able to make an eye contact, rapport. So all of those things are important. So this is the reason why I always prefer to see patients in a specific place in a clinic where they have a good tele-supervised system, a good connectivity, so that I can see the patient as a whole and provide the consultation. So I have personal experience with it. But again, don't quote me. A study published in International Journal of Social Psychiatry in January 2022 queried 530 telepsychiatry patients at a university hospital along with their doctors. Patient and doctors alike were asked to rate their satisfaction with telepsychiatry. Among the doctors, the satisfaction rate was 87.5%, and among the patients, it was 87.5%. So both the acceptance from the patients and from the care provider are equally balanced. And that is the evidence which is unfortunately or fortunately in favor of telepsychiatry. Now we have lots of systems available in the laptop where you can download an application, which application through which you can write the scripts, send the scripts to the faxes and the various pharmaceutical stores where they can be dispensing the medication to the patient after receiving that fax. And it's safe, secure, and the chances of breach are less. So we have to devise this mechanism, and it is now in practice. There are systems available which are without, again, any problems of being hacked or confidentiality breach and other areas. So this was another breakthrough in psychiatry in 2022. And brain gut axis. I remember 3 years ago when I came to Pakistan, I presented in a GI conference where big names in GI, Professor Aftab Mohsen and Javed Akram Saab and other people who are working a lot on GI system, they were there. And I talk about biometa and biomes. And they were also talking about that too. Research continues to shed light on the brain-gut axis. A 2022 study published in Translational Psychiatry showed some promising results for alleviating symptoms of MDD. The study found that short-term high-dose probiotic supplements were effective when used as an add-on treatment for depression. In this small study, 21 participants received a probiotic supplement for 31 days in addition to their standard treatment. Compared with the placebo of 26 participants, the patients who received probiotic supplement had scores of the HAM-D that decreased over the time. The probiotic group also had a lower potamin activation response when viewing neutral faces after receiving the supplements compared with the control group. Now, brain gut axis, this is just one study that I am quoting. If you go to the net, you will be able to find hordes and hordes of studies which indicates that if person is having somatic symptoms and they are more related to their GI, then giving antidepressants can improve their GI symptoms. In this study, I'm quoting that patients with MDD, when given antidepressants, if they are add on with the probiotics, it's just like a supplement once a day, then of course their improvement rate is significantly high. So this was another breakthrough in 2022. The best breakthrough, AI, artificial intelligence. You all know about ChatGPT, and you know what it is doing in our system. And people have started using it so much that now things are getting complicated, and people are scared that maybe a day will come that there will be no more psychiatrists. So people will go to a place where there will be a robot sitting there using artificial intelligence, would be able to assess people and then give the treatment strategies. For the timing, we are far from that point, but maybe in next 50, 70 years, you never know. But as a mental health care system struggles to meet demand, artificial intelligence is poised to alleviate some of the administrative burden for psychiatrists and other mental health care professionals. A study published in Information System Frontiers in May 2022 helped to explain one of the possible ways. The researchers behind this study developed a clinical decision support system called Psychometrist. Now, Psychometrist is from Psychometrist, called Psychometrist, a web portal that gathers and saves responses to the SCL90R and houses them in a database. The researchers trained AI and machine learning models to predict mental health disorders such as depression, anxiety, and Psychometrist was able to diagnose mental disorders with 89% accuracy using 28 questions. So this is just the beginning in AI, and probably AI will be used soon for informational care. AI will be used to counsel, to provide DBT, to provide CBT, to provide other things, gathering data and then implementing into it. So we are there. So the research is published in multiple journals. using artificial intelligence in mental health disorders. So it is very significant. These are the 7 big breakthroughs that I was able to see. Any question or anything you want to ask? Go ahead. No question.
So for the
sorry,
Please
पहले
go
आप
ahead.
पहले बोल रहे हैं डॉक्टर कामरान पहले बात कर लें then I'll speak.
Dr. Kamrani, I think I was talking to it's okay, I can talk first.
Sure.
So the second study that you said that about the genetics. So basically in that study, it's only the cytochrome P450 system that is used to assess which drugs would act, or there are some other things as well.
So basically, this psychogenomic testing includes multiple systems. Previously, when it was initiated, it was only one system. Now they have broadened it. And it is usually the drug, various enzyme system covering through which this drug is metabolized, and then other parameters as well. It's not just one thing, cytochrome B450. No, it's actually a broad range. So as I said in the beginning, there were only few drugs because that psychogenomic test was addressing only few systems in the body. Now they have addressed most of those things. So various enzyme systems, various genetic combinations, various other genomes involved in it, and responses of the drugs as far as other system is concerned. So now we have a broader range of drugs. Almost all antidepressants and antipsychotics are covered now. They are not just one enzyme system. It's multiple, right?
Yeah. Okay, sir. Thank you.
You're welcome. G. Manur.
सर एक तो ये टॉपिक बहुत अच्छा था मेरे लिए सारी चीज़ें हैं बहुत न्यू थी और मुझे लगता है लाइक फॉर FCPS पार्ट 2 कैंडिडेट्स तो ये वैसी चीज़ें बहुत इम्पोर्टेंट हैं सर ये जो इसमें अभी फ्लूवॉक्सामीन वाली बात कर रहे थे आप रिसर्च कोट कर रहे थे मेरा एक क्वेश्चन आ रहा है जहन में कि व्हाई डिड दे चूज फ्लूवॉक्सामीन इन द फर्स्ट प्लेस मतलब क्यों क्या इस बारे में भी कुछ मेंशन है like why fluvoxamine was chosen for COVID-19 patients?
It was not chosen, actually. It was just a chance. So I
Oh,
remember 4 years ago, it was just a chance that somebody found out that people who were taking fluoxamine were not actually going to the hospital because they were doing better. Then they tried the other antidepressants as well, but none of them had a good response rate. Specifically the fluoxamine, because of its again different enzyme system, as the other doctor was saying as well, they found out that only fluoxamine is able to protect people from getting hospitalized if they are having COVID-19 infection. And then they started collecting the data. So other antidepressants were not seen to be effective in controlling hospitalization in COVID-19 patient. It was just by chance. They never actually thought of doing it. आपको पता है COVID-19 infection, when they came in, initially people were giving tetracyclics, terramycins, they were using so many other drugs and steroids and high dose of liquids, fluids, and ultimately everything was collapsed. And they said, no, there is a very specific 3-tier approach. You have to do this, and you will be able to find the results in COVID-19. So it was hit and trial in the beginning. And I believe that this started with the hit and trial, but then it proved with the research paper published that they had the data that these many people were actually having COVID-19 infection and they were given fluoxamine and their hospitalization was reduced. So it proved one point. It was nothing specific. But people have definitely then started noticing with other antidepressants as well. But I don't think so they were able to find something significant. Adil Zahir Saab, Jeet. Unmute yourself and then talk. You raised your hands. Okay. Right. Anybody else? Any other question?
So there is not a question, but it's just something, one of my experiences that I wanted to share with you, sir. It's about ketamine. So
Mhm.
in 2021, when I started training at a government hospital in Islamabad, one of my seniors who was in final year of training, he told me about this ketamine drug and how it affects, and all the research articles that are being published in its favor. So we did try it on a few patients, and it really worked on them. But again, then after my senior graduated, I had difficulty in acquiring ketamine, and the anesthetist didn't allow us to get our hands on it. And before that, we had few people we knew in anesthesia department who used to give us that. So but we tried it on a few patients, especially in major depressive disorder. There was this student who was doing his mbbs in another medical college, and he had tried everything, and that didn't help him. But a few sessions of ketamine did help him, and it proved really nice.
So it is, again, as I said earlier, people have tried it, right? But unfortunately, not all people responded to it. So if you go and look at the studies, ketamine was used for schizophrenia, ketamine was used for other psychiatric disorders, and ketamine was used for MDD in general as well. But most conclusive data that I'm presenting, and that you should know and be very clear about it. Don't quote it anywhere the way you are quoting it to me. Please don't do that. Examiner fail कर देगा और दोबारा पास नहीं होने देगा. ये जो पहला जुमला बोला ना, ये बड़ा खतरनाक है इन माय एक्सपीरियंस. मेरा एक्सपीरियंस जो है वो कितने साल का है, इस पे लोगों को बहुत एतराज होता है, एग्जामिनर्स को बहुत एतराज होता है. सो ये जुमला कहना भूल जाओ, मत बोलना कभी भी. Especially I remember one of my senior examiners who was again my examiner too, and one of the candidates actually said this, and he made sure that that candidate failed for 3 years. So I'm telling you, giving you a warning that it's a very sensitive point for some of the examiners. Not all. Generally लोगों को इतना बुरा नहीं लगता, लेकिन कुछ एग्जामिनर्स को बहुत बुरा लगता है. सो आप क्यों चांस लेते हैं, ये मत बोलना. हाँ, yes, ketamine has been tried for MDD, ketamine has been tried for other disorders, but this data that I am presenting is only conclusive for suicidality. Ketamine works best for people who have high suicidality tendencies, not in other disorders. In MDD, data is still not so sufficient. In schizophrenia, other disorders, data is still limited. Same goes for transcranial magnetic stimulation. Again, one of my student who is now a professor, of course, so he is having a TMS machine in his place, and he's been giving it TMS for people with cocaine addiction, people with substance abuse, people with MDD, people with pain, myalgias, and so many other disorders. And he has collected a hordes of data related to it. I always wanted that data, but he never gave it to me. I wanted to publish the papers because that data is just lying down with him. So I asked him that, why don't you give me the data? I'll publish the paper. You will be the first author and I'll be the last one, but just let's publish it. But he never published it. So, Dr. Saab, point is that you may be having an experience of something unless or until you publish your research and your research is accepted as a genuine research paper, things are not conclusive. When the things are conclusive, then they go to the, again, textbooks. So most of our, we also, myself, we read textbooks to pass the examination. We don't read the research papers. And the textbook, when we quote it in exams, are accepted as it is. If you say that I have read it in Oxford textbook of psychiatry, then everybody says, okay, fine, this statement is okay. But if you say, in my experience, or if you say, in Dr. Nasir's opinion, they will kick you out of the exam.
No, sir.
So data is always important. One, published research. Two, then published research with meta-analysis or Cochrane reviews most powerful. Most of the time, when the review article, meta analysis, or Cochrane studies are published, they get the part of the textbook, not other research papers. हर साल इस दुनिया में 1,37,000 आर्टिकल्स पर मंथ छपते हैं सिर्फ साइकाइट्री में. उन 1,37,000 आर्टिकल्स में से शायद एक या दो यूनिवर्सल एक्सेप्टेंस के लेवल पे जाते हैं, और उनमें से जो 10, 12, 15 यूनिवर्सल लेवल के एक्सेप्टेंस पे जाते हैं, उनमें से कोई एक आधा टेक्स्ट बुक का हिस्सा बनता है. So it's very difficult process, but still, well, yes, if you feel that you had a good experience, collect the data. Start collecting the data. 2, 4, 5 सालों में आपके पास बड़ा अच्छा नंबर इकट्ठा हो जाएगा. Publish the paper and it will be significant, right? So अभी फिलहाल only suicidality for ketamine response. और कोई question?
Okay, sir. Thank you so much, sir.
Okay. Okay. Thank you very much, everyone. It was a small brief, but I never wanted to waste this Friday. I had time, so I thought that I should do something. Thank you, Manur. Keep posting me
Thank
the
you,
top,
sir. That was very helpful.
and I will definitely try to cover up the topics. There are more topics, so don't worry about it. And Kamran, if you would have stayed in Pakistan till 2nd of November, I would have seen you, but maybe sometime in Ireland, maybe in winter vacations.